Hello and welcome to the next installment of Cylinder Radio. Our topic for today is going to be healthcare, more specifically single payer or universal healthcare. And my guest is probably one of the best people I could ever talk to about this topic. And it is Dr. Paul Song. He is a radiation oncologist. He is the president of Physicians for a National Health Program. And he has served as, do you want me to start that again? Let me just start that again. Did I say that even right?
Yeah, that's fine. But
Okay.
again, you can just say, just these, whatever you want to do, but it's
Okay.
fine.
Okay, let me try that. Let me try one more time. 'Cause I'm like not a show business person. I'm trying to like do this podcast and it's just always a mess.
I think it's awesome you're doing this, though.
Thank you, man. All right. Okay, thank you. Why am I saying thank you? Let me try it one more time. I promise this is the most I've screwed up. Hello and welcome to the next installment of Cylinder Radio. Today our topic is healthcare, more specifically single payer or national healthcare, universal healthcare. And my guest is probably one of the best people I could ever talk to on this topic. My guest is Dr. Paul Song. He is a radiation oncologist. He is the president of Physicians for a National Health Program, and he has formerly served as a healthcare policy fellow in California Department of Insurance. I got that right. All right. Dr. Song, thank you so much for coming on this podcast. I really appreciate it.
Pleasure to be on.
So, healthcare is something where we are very divided. It's become a very politicized issue. It's something that we are all going to have to face at some point in our life when it comes to medical issues and things like that. And yet it's so polarizing. I think we can hopefully have a good conversation and clear up some of the misconceptions about this, because that's a real goal of this podcast is to just inform and educate. And maybe we can point out some of the areas where people seem to be misinformed or they have views that maybe aren't particularly accurate. So maybe just give us a little bit of an introduction to yourself and why this particular area would be pertinent to you specifically.
So as you mentioned, I'm a radiation oncologist, which means that I treat cancer with radiation. And I've been practicing for over 20 years. And over this period of time, I've developed very close relationships with countless numbers of my patients, all of whom have been fighting their battles with cancer. As a radiation oncologist, I saw far too many of my own patients who had cancer develop real financial difficulty as a result of their illness. Despite the fact that they had insurance, many of them were going bankrupt. Many of them were unable to get the treatment that they needed because the insurance companies were denying them the care that they needed. And as a result, between the costs of pharmaceutical drugs that they needed, therapy that was not covered by their insurance companies, it's sad, but one out of roughly every 3 cancer patients goes bankrupt because they are decimated by either the fact that they can't pay their bills, or due to the fact that they can no longer work because of their illness, they can't keep up with the expenses. So I started to look at healthcare in general, what was right about our system, what was wrong. And what I soon began to realize is that our system is very inefficient. It's very focused on profit and less on actual patient care. And have since devoted my efforts to try to change our system.
Wow, that sounds great, but that's also such a staggering stat that one out of 3 and it makes sense. 1 out of 3 cancer patients end up going broke. Like it makes sense. I mean, I know from having family members, and I had a health issue in September. I actually had a stroke. I had a venous sinus thrombosis. It just came out of nowhere, and it got really gnarly. And I had health insurance. It ended up costing me like $4,000 after insurance and stuff like that, which isn't that, it's not that much for me as a school teacher. My wife runs a business and stuff, but that could be real. That could be a lot. I mean, for $4,000 is a lot of money.
Absolutely. And what you touched upon is, I assume because of your work as a teacher that your union has negotiated good insurance for you. But a lot of people that have insurance out there, sadly, the insurance isn't worth the paper that it's printed on. And while 1 out of 3 cancer patients reports having financial harm, there was a recent study that showed that of all the bankruptcies in the United States each year, 2/3 are actually due to caused by medical illness. So, again, the whole idea of having insurances is supposed to insure you, to protect you from the financial cost of care that is needed once you get sick. But unfortunately, our system has sort of not delivered on that end.
Yeah, well, I'm actually at a private school now. When I taught public, though, the insurance was much better than what I had now. I mean, it covered like my wife, who was my girlfriend at the time, and everything like that. It was great.
Right.
Because they have to do the collective bargaining
Right.
type stuff. So I guess to start is like the American system that we have clearly has flaws. My wife was born in the Philippines, and I've kind of like been adopted in as this big white oaf and a bunch of Filipinos in my family. And they have a lot of families still over there. And they talk about how over there, like if you go into even the emergency room and you don't have the money or the insurance, then they just turn you away. Where in America, like at least we have the emergency room where if your life is in danger, they'll take you in and pull the harpoon out of your chest or whatever happened to you, bandage you up enough to keep you alive, and then send you off. If you can't pay for it, then that's just like something that the cost that they have to eat. So I think that is that accurate as far as the way that it works here?
So I will say this, that I think that there is no perfect healthcare system, but you have to wonder why in the United States that, we spend twice as much per person in the United States as any other modern industrialized nation, and yet we still have close to 30 million people that are uninsured here in the United States. And then we still have roughly 1 out of 3 people who has insurance. The insurance is so bad, meaning that they have such copays that are so high or deductibles that are so high that they delay seeking care. And again, if you're uninsured, your only recourse is to try to go to the emergency room. But then at that point, you're saddled with tremendous amounts of debt. So everything that you just said is absolutely true. And it begs the question, and again, regardless of where people stand on their political spectrum, I think we can all agree that our healthcare system is not working as well as it should be.
Right. And I think that's a great place to go from, because I'm studying a lot about education, how to improve education, because that's kind of my realm. And again, yeah, I agree with you. Like left, right, Democrat, Republican, everyone can agree that like this can get better. Like let's just focus on how we can improve this. And I don't know if I said at the top, but this healthcare is something that I have a lot of students ask me about, being a government teacher, and I run like a model Congress and debate and stuff. And I'm really ignorant when it comes to healthcare. So I'm excited to be able to clear this up, because I know if I don't know a lot about it, there's probably a lot of people that don't know a lot about it. Typically I would go to when students have asked me, and this might be really wrong, I'm glad I get to clear it up, when they say like, why can't we have universal healthcare when all these other countries do, like Canada does and whatever, Finland or something like that? My response, and this might be wrong, has been, well, Canada doesn't have the military that we do. They have 3 moose with like a cannon strapped to it, where we have this massive military. It's very expensive. Canada doesn't need one because no one's going to attack them, because we have the strength to protect all these allies, and they're kind of riding our military budget coattails, and then they get to do that. I don't know if that's accurate, because like you said, like it's not just that it's coming out of our budget. It's just it's more expensive for us as the individual consumer as well.
Again, I think as mentioned by numerous people, healthcare is complicated, and it's certainly expensive. In our country, we currently spend about 18% of our entire GDP on healthcare, but we also spend a significant amount on our military, as you mentioned. And so yes, there are a lot of other issues, but I will say this, that with regard to our military, they prior to the Iraq War, the VA system and our military healthcare system was one of the top systems in the world. What happened was we had a war that we initially went in thinking that we would be greeted as liberators. And I was actually working at Walter Reed when that war broke out. And you had a lot of people who thought that it would really be a cakewalk. And we were never prepared for the carnage we were going to see. The number of young men that I used to see coming back who had traumatic brain injuries and limbs blown off were something that we never imagined would happen. And as a result, it overwhelmed our military healthcare system to the point where it's never quite recovered. And that's where you hear all the criticism of the VA now. But I will say that prior to that Iraq war, our military system was the best, most efficient healthcare system that was around. And so I think I just want to, let me just kind of take you through one thing that I think it's important for your listeners to understand. You're going to hear all different types of healthcare systems bantered about in the upcoming presidential campaign, both on the Democratic side as well as the Republican side. But I do think that it's important for people to realize the different terms. So there's a term called socialized medicine that a lot of people like to use disparagingly. Now, socialized medicine is when the government owns and operates every aspect of the healthcare system. It owns the hospitals, it hires the doctors, the nurses, it owns the pharmacists, the x-ray equipment, every aspect of the healthcare system.
I'm sorry, would that be like is the VA run like that?
Correct. So that's the VA system, right? And ironically, the socialized system that everyone likes to criticize is taking care of our military who are designed to fight for our freedom, right? So it's pretty ironic that the military is covered by a socialized system. You then have a private system, which is kind of what a large number of your listeners they or their parents may participate in, which is the private insurance market. It's the Blue Cross Blue Shields, it's the Kaisers, it's the Aetnas, the United Healthcares, where either they or their employers pay a monthly premium and patients get some degree of coverage. So then when they get sick, the insurance company will supposedly cover those expenses and costs. So that's the private market. But it's what we call a multi-payer system, meaning like with your job, maybe this year, all of the teachers at your work this year get coverage through Aetna. But then next year, because Aetna's rates were too high, your school may renegotiate and now you have a contract with Kaiser, or you may have a contract with United Healthcare. That's something that can constantly change. And then the third system is Medicare, which is a government-run system that takes care of all of our seniors over the age of 65 or the disabled. And that is what we call a single payer. The government serves as the sole payer of that. They collect tax money, they administer it, and then they pay it out to hospitals and doctors. And then the last system is Medicaid, which is for our poor, where the federal government comes up with 50% of the money and the state, like the state of California, comes up with 50% of the money, and they take care of patients who make less than 133% of our poverty level. So those are the major healthcare systems that we have, and each one by its own way is somewhat complicated. Now, think about a hospital in your neighborhood, right? Somebody gets sick, they show up to the hospital. The hospital's got to figure out, well, what kind of plan are they in? Are they a military plan? And maybe, let's say it was a soldier that was in a car accident. They couldn't take him to a military hospital. They had to take him to the local community hospital because that's where they lived. It was a life or death situation. Now they've got to figure out, well, is the military insurance going to cover this gentleman or not? Same thing. If you walk in the door, are you Aetna? Are you United Healthcare? Are you Medicare? Are you Medicaid? They've got to hire somebody to figure out what insurance you have, and then if that hospital is in network, meaning does your insurance allow you to go to this hospital, or do they have a contract with somebody much cheaper that's 20 miles down the road that you have to go to? And it's this complexity of our system that makes our system so inefficient. It's the complexity of our system that makes us spend more money to hire people to handle administrative decisions rather than people to actually take care of patients or along those lines. So that is, at a nutshell, what our current system is. It's very complicated. It's very inefficient, and as a result, it's very costly.
That makes sense because, like, I teach like about taxes and things like that, and it's kind of a similar thing. You look at the tax code; it's unbelievably complicated, and in that, it just there's so many little loopholes, and there's ways for people to kind of manipulate it in all these different ways. It's kind of funny. I say to my students sometimes, I don't like reading long essays because it's easier to kind of BS your way through a long essay, like a 15-page paper, compared to like a one paragraph. Because it's like that might be something kind of like that would apply here with the insurance.
Well, again, I think what it is though is unfortunately the insurance companies become so powerful, and the pharmaceutical industry has become so powerful that they really do dictate the majority of the decisions that are made.
So here's where I get to is, education is failing in a lot of ways, and I'm reading a book on it now, and I'm trying to like figure out. I believe in the free market in so many things. I believe in capitalism, and I believe in the free market for a lot of things. I've questioned it when it comes to like media right now, because if capitalism gives you the product and price that you want, then the product of media that you want might not be good. It might not be something good for your knowledge, because you're just gonna create an echo chamber and things like that. And private prisons are something negative. But I wonder if there is still a free market solution to these problems. There's something that I was thinking about with private prisons, which seem to be not very good, because your customer are inmates. So how do you make money is essentially cutting corners and things like that. But I was thinking, like, what if the recidivism rate at a prison is like 85%? Well, what if you get paid X by the government funding for recidivism rate at 80%? And then if it goes to 60, you get 2X, and you drop that down to 40, it becomes 3X. And then private prisons, their incentive motive will be to rehabilitate. Like, is there a way that we can do this with healthcare where the incentive is to keep people healthier? Like, can we make a profit motive anywhere? I'm always looking for like how we can make a profit motive in doing the right thing.
So I'm just gonna I would. Let's start with the free market. Okay. There is no free market in healthcare, and I've heard people say, okay, we'll let the free market take place. First of all, there's been such consolidation among big insurance companies that in some parts of the country, there's only one choice of insurer. So 90% of Alabama has Blue Cross. Okay. And if you want private insurance. So there's not a whole lot of free market ability to negotiate insurance rates. So
it's monopolies and oligopolies. Yeah. It's like a few that makes sense. So it's that.
So and then the second thing is this. I've also heard other libertarians, and I have a lot of good friends of mine who are libertarians, say, well, the patient should just negotiate directly with the hospital or the doctor. Yeah, it's one thing if you need to have a mole removed from your back, it's an elective surgery, that's fine. But if you have a ruptured appendix, if you have an emergency heart attack, you don't have time to shop around with doctors to get the best price or the hospital to get the best price. So I just don't see the free market, quote, working as well as it should be. I will also go as far as to say that Charlie Munger, who was Warren Buffett's deputy, right-hand person, last year basically called medical costs the tapeworm of American competitiveness. He said our cockamamie system gives our companies a big disadvantage competing with other manufacturers. Most of the other manufacturers they're competing with live in countries that have single payer, and we're paying for healthcare costs out of our company. And I will argue that prior to the bailout, General Motors was spending more money on healthcare costs for its employees than it was on steel to build cars. And if a big company like GM cannot negotiate steep discounts on healthcare costs, I'm not sure how the average individual can do that. Last thing I will say is you mentioned you recently had a stroke. Yeah. And it sounds like how old are you now?
I'm 36. 30.
Right. And otherwise do you exercise a lot and yeah. Right. So I've heard that bantered about by a lot of people, more personal responsibility. It's the people that are obese. It's that are screwing up our healthcare costs. You know what? For every person that's obese that has not taken care of themselves, I can give you countless stories of individuals like yourself who have constantly done the right thing, A friend of mine is a triathlete. He exercises like crazy, but he had a really bad accident on his bicycle, broke his collarbone and his wrist, and his out-of-pocket costs were so much that it was very financially crippling for him. And what I would say for yourself, that's to me a prime example. Here you are, you're young, you're not in a risk group of somebody who should be having a stroke, and yet somebody in their 30s had a stroke, and you've clearly been very active about trying to take care of yourself. So that's I think, unfortunately, a convenient excuse. Are there people that don't take care of themselves? Sure. Are they adding unnecessary costs to our healthcare system? Yes. But there are a lot of people like yourself, a lot of people who are healthy. I remember treating quite a few nuns who never smoked, never drank, and yet they came down with really bad cancers. So the idea that somehow they're not being personally responsible, I think, is not fair. And then the last thing I'm just going to say this about the Heritage Foundation, which is a very conservative think tank, every year puts out a study called the Economic Freedom Index. And what it does is it ranks all of the major countries based on business-friendly policies, a lack of regulation, all of the things. And if you look at all of the countries that are ranked ahead of the United States, all of them except one country, Mauritius, I think I'm pronouncing that wrong, but all the other countries ranked ahead of the United States provide universal government health care for their employees and for their citizens. So the idea that somehow health care is an affront to freedom, it's not borne out by the most conservative studies by like the Heritage Foundation. The other thing is, I will say, we heard the same thing about the Affordable Care Act, right? That it would be a job killer. But if you go online and you look at what day the Affordable Care Act was implemented, job growth has gone up every month since then. And so the idea, again, that a government-run health program, and the Affordable Care Act really was not really that, is a job killer, takes away personal freedom, is simply not true. I will say where the lack of freedom exists in our healthcare system is if you are in a job that you absolutely hate, and the only reason you keep that job is because the health insurance, that if you leave the job, you're going to lose your health insurance. That to me shows you how little freedom we have in our healthcare system. And then the last thing I will say is that everyone's always concerned about the government getting between them and their doctors, but in reality, it's the insurance industry that's constantly getting between you and your doctor every day. They're telling you first of all, which doctor you can go to, what hospital you can go to. They're telling your doctor what prescription they can prescribe for you, what blood test they can do for you. So the people need to take a step back and look at what the reality is. I will say most of your listeners, if they've had to go get a prescription filled, sometimes they will see that the insurance company, oh, ma'am, your insurance company is not going to cover this drug. Here's a cheaper alternative. So it's not the government telling people how to practice. It's by and large a for-profit industry that only makes money by denying care.
Yeah, there's a lot there that I actually only wrote a few notes before this. So one of them was about the healthy issues. And yeah, I mean, I was in the best shape of my life when it happened. I mean, I was doing swim sprints. I was eating healthy. I didn't eat sugar at all. I was like really diligent about it. And just like stuff happens. I mean, we are an unhealthy nation. We're poisoning ourselves with our food. I mean, the numbers of like diabetes, type 2 diabetes is staggering. I read something about like just pre-diabetic and diabetic people. It's like, it's approaching something like a quarter of our citizens or something like really bad. Like, you can do everything right. You hit the nail on the head, because I thought I was doing everything right. And then I was in the ICU. So it doesn't save you, but is there an incentive to take care of yourself more if people are going to have to pay for it? I don't know. I think there is something legitimate, I'm sure, as you do, that we should be healthier as a population. But I don't know if that is, the only kind of answer to this. The other thing that I just want to say is, the concept of big is bad is something that is universal, again, to both sides of the political aisle, because typically it would be people on the left are critical of big business and people on the right are critical of big government, but big is bad. Like, and so a monopoly is bad when it's in like the free market, and it's bad when it has just control over everything. We got to be careful of the idea of something getting so big that there is no alternatives. But I don't know, maybe healthcare is one where the alternative is clearly wrong, is clearly not getting us into the right place. So we have to have a monopoly. Like we have a monopoly for our United States military. It's good we don't have private militaries with fighter jets and stuff just in case. Like there are certain things that we need to have to protect our people, and that is, maybe one of the areas that where this would apply, that like certain things are big and good, like for instance, like having a military that I feel safe with my kids here, that we're not going to get invaded or something along those lines. The last thing is that you mentioned the Affordable Care Act. From my experience talking to doctors, why is it that, I don't know, maybe this is just from my little like bubble, but it seemed like a lot of doctors were not fans of the Affordable Care Act. So what is that not accurate? Or if it is, like, why is that?
Actually, I think that most doctors will now tell you the Affordable Care Act was actually positive, not negative. Certainly the American Medical Association, who is predominantly conservative in their ideology, when the Republicans were trying to appeal the Affordable Care Act, they loudly protested and lobbied hard against that. And the reason being that, despite all the rhetoric, the Affordable Care Act was not a government takeover of healthcare in any means. What it was prior to the Affordable Care Act, you had about 50 million people in the United States who were uninsured. And what the Affordable Care Act was it reduced the number of uninsured from about 50 million to about 30 million. The majority of the people that got coverage under the Affordable Care Act were the very poor in states where they expanded Medicaid to now give them access to care. And then those that were making just enough money to get by, but not enough that they could afford health insurance, they were all getting a subsidy. So what I would always say the Affordable Care Act was less than a government takeover, is more of a corporate bailout. Essentially, it raised a lot of money to basically mandate people who didn't have insurance go buy insurance, and most of them got a subsidy. So what it was basically each of those of you that were making less than 400% of the poverty line were getting a subsidy from the government to go buy private insurance. And why doctors actually like that is because more and more patients that they saw had insurance compared to what it was before. So there was no real institutional takeover of their practice. There was no, things that all the fears that people thought. It was not, a government takeover of their practice at all. If anything, most people, insurance, the number of people that doctors that were treating private practice doctors were actually didn't really see any change whatsoever.
So why is there such division here? Like what is it? How did this become like, single payer or universal healthcare is a liberal left Democrat thing, and then the free market but like these just a couple of big companies is a conservative thing? Is it just this idea that of entrepreneurship and the American dream side of like the conservatives that say like, hey, like let's have competition, and they don't know that it's not really competition? Or like what would stop like you and a couple of friends and we get together with like Elon Musk or some, rich guy, and we say, hey, Oprah, whatever, we say like, hey, let's start an insurance company. Like, why does that not kind of happen much? Or I don't know. That's a lot of questions in there, but.
So a couple things. One is, people have to realize that what President Obama implemented was essentially a Republican idea. Remember, Governor Romney, when he was governor of Massachusetts, implemented the plan that President Obama ultimately ended up adopting for the federal system. And prior to that, if you go back to when Nixon was president, you then had Ted Kennedy at the time, who wanted to start a Medicare for All program. And Richard Nixon, in response to Ted Kennedy, said, no, we need to institute an individual mandate, personal responsibility, and then make everyone buy insurance. So, the Affordable Care was, not to sound cynical, but I think that had anyone other than President Obama introduced the Affordable Care Act, people would have not been so objectionable to it. Because in the end, if you took a step back and you analyzed it, it was originally a Republican idea. There was no public option. There was no single payer like some people that were more left wanted to do. It was essentially a Republican idea, and yet the Republicans had to try to smear it, tried to do everything to defeat it, which I think was really unfortunate. Kevin McCarthy, who's up in Bakersfield, who's now the Republican majority leader in the House, his district, of all the districts in the state of California, benefited the most from the Affordable Care Act. The number of people that are uninsured in his district, the number of people that got Medicaid as a result of the Affordable Care Act has been more profound in his district than any other district in the state of California. And yet he was willing to follow some blind ideology rather than what the truths were. So I think if you really, look at what the Affordable Care Act was, and that's why the public opinion changed so much from when the Republicans really did a good job of demonizing it. So then Obama and the Democrats took a shellacking in the House right afterwards. He lost his majority in the House and Senate. But that's why this election, the number one Google term prior to the midterms was healthcare, because even people in Republican states, if you talk to John Kasich in Ohio, he expanded Medicaid. He'll tell you the Affordable Care Act was a boon to the state of Ohio. And that's the sad part is people can't even be truthful about what's good and bad. And
they have to toe the party line.
They toe the party line.
Yeah.
And that's where you started to have a break with some Republican governors finally saying, no, I'm going to expand Medicaid because it was actually positive to their state.
Yeah, I think that maybe if this is like somewhere where we can go is like, if you view the healthcare system as a monopoly, as a private monopoly, maybe you'll start to understand, some of the criticisms of like how we need to change things, because we understand that when it comes to a lot of things. We understand, going back to Rockefeller and Carnegie days and like the dangers of that. We know why we have the Sherman antitrust laws and things like that. It makes sense that if that's like what we have here essentially, and like you said, there's several states where you don't have a lot of options. I didn't have a lot of options. Maybe that's a good way to view it. So.
Oh, but along those lines, so do you realize there are only two industries in the United States that are exempt from antitrust legislation? And they happen to be Major League Baseball and the private insurance industry.
Okay, so that's like what, that was just through lobbyists got that?
I think, yes, it's a common lobbyist, yes.
No, I did not know that. So that's really interesting that you say that. So, as I was saying, those words are coming out of my mouth. I was like, well, but if it was a monopoly, then they would be going after it. So, okay, this is interesting. I guess this is a little bit of a side note, but it's still applicable. Is like, where is the line drawn? If it is, a universal healthcare system, or even a healthcare system now, where's the line drawn about what should be covered and what shouldn't? I've been looking into. My wife's really interested in these like anti-aging things like NAD and stem cells and all that kind of stuff. Like at what point, it came up a lot with like transgender community and stuff like that. Like at what point is it a luxury? And at what point is it healthcare? Because stem cells, I mean, if you have a bad knee injury, you inject that with stem cells, you are better, but it's expensive and things like that. So what do you think about that? Like at what point is like in the future, will stem cells just be like commonplace for healthcare, and at what point is it like a luxury? So
a couple things. One is I do think that we have to be realistic and set expectations. So here's what I would say is that most people who have private insurance right now look at what's covered and really what's not covered. Use that first as what is your standard right now? And I will tell you that there are a lot of people who won't get a lot of things covered right now with the insurance that they have. So when I hear those same people say, well, I don't want the government dictating what I can and can't get, I can guarantee that at least Medicare, which is the government-run healthcare, allows for far greater benefits in terms of what's covered and what's not compared to most people's private insurance. So I think people need to realize that the big scary government isn't necessarily going to make your healthcare worse. Now, having said that, I also think that any government-run healthcare program, it's not going to be perfect. I've never made any false promises about that. But it'll be better in the sense that everyone who, compared to what we have right now, as I mentioned, we still have 30 million people that are uninsured. And then we probably have another 31 million who are underinsured, meaning the insurance that they have, if they get sick, chances are it's not going to protect them from financial harm. And so I think at least with a government-run program, we're not going to have medical-related bankruptcies anymore. And now, will there still be certain things that are not covered? Yes. But I also think decisions will be made by a team. When Sarah Palin was saying death panels, no, it'll actually be based on medical evidence rather than what's the cost. So that's the difference between, I think, a private insurance industry deciding what things are going to cover for you versus, say, a government-run program like the VA. The VA is looking at what does the medical literature and the data support versus in the private insurance industry, you might say, yeah, the medical literature supports that, but it's too expensive and we're not going to pay for it. There's a big, big difference there. Now, getting to the whole thing with stem cells. I have a lot of friends of mine who are orthopedic surgeons, and the data on that is mixed. So for everyone that has had a good response, there are a lot of people that have no response at all. And if you look at the medical literature on that, there's no great data to say that it's an absolute cure-all.
Right. Yeah, I don't know. I was just using that as an example.
But I'm just saying. Yeah. I'm just saying that if somebody does a personally, like a well-done, peer-reviewed study that's New England Journal worthy, or just say it goes into a orthopedic journal that meets all the scrutiny and it clearly shows a benefit, then I think those types of things should be included. Now, cosmetic surgery, things of that nature, I think that would all be elective. But basic things to keep your health would be covered. And again, what I would just people like to say, well, they're worried the government's going to come in and make access to care worse. That's not true. Seniors who have Medicare, who need a hip replacement, get a hip replacement much faster than seniors who have private insurance. Because private insurance companies are you have to go through pre-authorization. They go through an overall process. It takes much longer. And that's all I'm going to just say is people need to stop believing the lies and look at what the reality is in our healthcare system right now.
Yeah, I think I even in my own head, I'm thinking oh man, it's almost I prefer the devil I know compared to the devil I don't. I wonder if there could be something like how Colorado did the kind of experiment in a federalist idea of let's see what legalized marijuana, recreational marijuana looks like and see how it goes. I don't know if it would work budget wise, but if a few states adopted it and then see how it works, I don't know if that would be something where you need to just jump in with both feet into something like this as a country, or if we can do these little pockets, these little experiments around it from state to state and get it there.
I think certainly certain states like New York and California last year were trying to implement their own state-based plan, and ultimately that may be the way we have to go about it. So yeah, listen, I think the reality is any plan that ultimately is going to help people is going to run into tremendous opposition from corporations. So the Affordable Care Act, it was written by, everyone says Democrats, but the reality was there were 3,300 registered healthcare lobbyists for the 535 members of Congress. So roughly 6 lobbyists for 1 member of Congress. They were spending $1.2 million a day in total, more was spent lobbying for the Affordable Care Act than the entire Bush-Kerry election. And that's why large parts of the Affordable Care Act look like it was written by the private insurance industry and pharmaceutical industry. What do I mean by that? There was no insurance rate regulation, so premiums have continued to climb and more people having difficulty paying for their health care. There was no drug pricing controls. So that's one of the things where you hear all of these seniors foregoing getting their medicine. In 2016, there was a study done by the Commonwealth Fund that showed 45 million Americans, 45 million people reported that they didn't fill a prescription that year because they couldn't afford it. So, in the end, it's as much, not so much Republicans against Democrats. It's really people who are beholden to the insurance industry, pharmaceutical industry against everyone else.
Yeah, and that's just in closing, like that's just something that has to happen. Like people are going to, not maybe it doesn't have to happen, but it does happen because people are going to look out for their best interests, and they justify it as, I have all these employees, and these employees need to have jobs, and like you really do justify it. We all do, and I think you can fool yourself into doing some things that aren't right by justifying it as like you are helping people. And there's a lot of people employed by these insurance companies, and they see it, well, they're all going to be unemployed, and so let's just continue down this road. So let's lobby hard for it because your jobs are on the line. I think people justify it no matter what the issue is.
But I will just say that like the single payer plan that Bernie Sanders introduced and Pramila Jayapal introduced 2 days ago, both of them very much have explicit criteria and funds set aside for job retraining for anyone that's displaced as a result of this. Mm-hmm. And I will just say this, for every other corporation, that instead of spending money to raise wages for their employees or capital improvement, investing in infrastructure, things of that nature, because they're having to spend more and more of their budget on healthcare costs for their employees, they're starting to wake up to this and saying this is not working either.
Yeah, that's a really good point, especially for reaching out to the people who are like, entrepreneurial, small business owners and stuff like that. If they start to believe that like this is going to save you, even big business owners, corporations, this is going to save you money so you can produce more, then maybe that's a way we can kind of all get on board and right. do something like this. That's really awesome. So Dr. Song, thank you for giving me your time. I know time is one of the most valuable things that we all have. So I really appreciate you taking the time to sit down with me and break this all down and have this conversation. Hopefully it's just a starting off point for a lot of the listeners and young people to look into this a little bit more. Where can they go to get more information?
Well, that's what I was about to say. First of all, thank you for doing this and having this discussion. I think, if anything, it shows that you can have discussions with people very open-mindedly, non-ideologically, respectfully. And I would ask anyone who wants to take a time to learn more about our healthcare system is to don't believe either side. Don't believe what the Republicans say. Don't believe what the Democrats say. Try to study it themselves. What I did was when my own patients were going bankrupt, I had to really research the data as much as I could independently because I didn't want anyone to tell me what was right or wrong. In much the same way, I would say that one source that does share a lot of data-driven results is Physicians for National Health Program, pnhp.org, has a lot of papers that have been published in big journals on what's right and wrong about our healthcare system. Anytime a politician does make a claim, they're the first to do an analysis of it, both in terms of calling out Republicans and Democrats. So I would say that's a good place for people to start.
Okay, I'll put a link on that in my Instagram. Dr. Song, thank you. Thank you for this, and thank you for listening. I hope this is just a starting off point so we can improve things. And man, I couldn't have explained what the point of this podcast is better than you did. Breaking from that ideological possession and just be open-minded to try and learn so we can make something better than what we have. So thank you very much.
Thank you, Will. Really appreciate it.
All right, take care.